am your host, Gina Donahue, owner and founder of Elevate Functional Medicine. And I have with me today Dr. Jonathon Chang from Sweet City Smiles.
Awesome. Thank you for having me. My name is Jonathan. I am a dentist here in Sugar Hill, and Gina invited me on this podcast, and I'm very excited. This is my first time doing a podcast, so just FYI. And I did get invited also to do a pickleball podcast, so this is good prep for that, so I do appreciate you having me on.
That's exciting.
Yeah.
Well, welcome. Well, Dr. Chang is my dentist, and during my last cleaning, we just started talking about how things are going with both of our practices, and I'm not quite sure how we got on the topic of stress and stress management, but we did. We started talking about the profound effects of stress on the body. Mm-hmm. And Dr. Chang mentioned that he's been really noticing an increase in TMJ and jaw-related issues post-COVID. And it got us to talking about really the profound effects of stress on the body. And it never really occurred to me that a dentist would be noticing the effects of stress on the body. I don't know why that didn't occur to me, because I do know so much tension, teeth grinding, all of that is under your direct care. So can you share a little bit with us about how you started to make that connection between stress post-COVID versus pre-COVID? Like, how did that come in your awareness?
Definitely. So I've been practicing for almost 10 years now, and opened up our practice right before COVID happened. So it was great timing, obviously. But post-COVID, we started noticing that a lot. And it wasn't just me, it's also my colleagues. But I think the reason I got a front row seat to that was my wife, Kristen, actually started having a lot of TMJ, or TMD, we call it, issues. And we had to take her to a specialist, and that's where my eyes opened more to that. So a lot of us, I think 1 in 3 patients will clench and grind their teeth, either at night or during the day. And most of the time they go unaware, and they're asymptomatic for the most part. But I think the combination of COVID with the uncertainty of what's going on and just the stressors that it added, plus opening up a dental practice and being first-time business owners, I think that combo of stress just kind of pushed Kristen's joints kind of over the hill, so to speak. Mm-hmm. And she started having headaches and joint pain. And so, we went to a specialist, and we realized what the issue was. So at my practice, I've noticed a lot of cracked teeth, sensitive teeth, jaw pain, and then the most severe would be joint pain and migraines and headaches. So it just starts kind of with this muscle, and then it can travel and get worse and worse.
And so talk about, how does that come up in a conversation in the dental office? My experience in the dental office is usually just getting my teeth cleaned and then trying to talk around your mouth being
and I'm still trying to remember how we even talked about this. Maybe I was stressing you out and the topic of stress came up, but no. So when we have a patient, and we're coming up with a treatment plan and making a diagnosis, we really want to figure out the root cause of what's going on. Mm-hmm. So oftentimes for most individuals and most dentists, we're seeing it from a bacterial standpoint, right? Oh. Gum disease, tooth decay, bacteria related. But I have a lot of patients who have excellent home care, who brush, who floss, and do all those things that we ask them to do. But they started having some dental issues, like a filling, but it wasn't created by poor brushing or flossing. Their molars actually had like tiny wear facets, like mechanical holes that were created, and the bacteria got in. And that cavity is different from somebody who's maybe not flossing, right? So I could see right there that a filling is not just a filling, it's what caused this cavity to begin with. So there was definitely that. Chewing pain, we see that in just the wear of the enamel. We've got intraoral cameras now that can get really close to the tooth and kind of magnify everything. And we can see like stress lines on teeth also. I can see cheek biting lines, and there's just a lot of signs that we can tell that it's more mechanically related than a brushing issue, for example. And then I think the other big thing is just getting a thorough medical history. I'll ask about my patient's sleep, or if they have sleep apnea. there's a correlation between sleep apnea and bruxism, which is the clinical term for clenching and grinding. So if your airway is more constricted or you're having trouble breathing, studies are showing that the movement of the muscles kind of reopen up the airway at times at night. So that can lead to more clenching and grinding too. For having sleep apnea can be correlated to that.
So after you and I had this conversation, I mentioned this to you just prior to us starting to film, I decided to just look up TMJ and COVID.
Yeah.
Because I knew that's what we were talking about today. And lo and behold, a whole bunch of research articles came up. I was like, holy cow, like we struck on something that's actually happening.
Yeah.
And other people are witnessing it so much that it's being studied in scientific articles. And the one article that I had pulled up and really read through the whole thing was about it talked about the increase of TMJ or TMD, TMJ, sleep apnea, and obesity,
Right.
all sort of converging together as this trifecta of post-COVID stress response.
Yeah.
Because obviously stress eating, lack of social interaction, isolation, increasing weight, increasing sleep apnea, and then also increasing tension.
Yeah. So I think that's a great point too. Post-COVID, a lot of remote working.
Yeah.
So 3 out of the 4 girls in my office that work up front on computers, we all have them in daytime splints. So splints and night guards are a little different. We can get into that later. But a lot of my patients who work on a computer, I guess there's just a lot of focus and concentration. And so I didn't know this until I became a dentist, but our teeth actually shouldn't touch unless we're eating.
Oh.
So a lot of people don't realize that. And so what happens is I'll have patients, take their fingers and put it right here where their masseter is. And I'll ask them to relax their jaw and not let the teeth touch. And then when they do touch and clench, the muscle will flex. So mine used to bulge out quite a bit, but I've, wear a night guard. I do a lot of other things to weaken my muscles, so to speak. And it's much better. But I have patients, they call them like jawceps, like biceps, but in the jaw. And it'll just flex a lot. And that's a clear sign that they are definitely clenching either at night or during the day or oftentimes both. And when I have this conversation, they'll come back or call me back and say, Dr. Chang, I realized I've been doing this all the time. And a lot of it is due to remote working. So it's just, muscle memory, a habit. The stronger this muscle gets, then when you go eat, now your teeth are hitting harder and we're seeing more cracked teeth and more chipped teeth post-COVID.
So is it that people are concentrating and maybe not talking as much, and that's why they're clenching their jaw working remotely, or what's
yeah,
the
I think definitely that. And I think just stress. I mean, it's a fight or flight response. And sometimes I used to see this more in athletes, right? If they tense up and they're throwing a ball or catching something, right? They'll be clinching, but now even non-athlete patients, I should say, are doing that. So I think it's a combination of maybe less talking, but also really focusing. And I think this a fight or flight response that now I think stress is just part of the norm for us, unfortunately. It's just a habit. Like if I'm lost in thought or stressed, I will shake my leg a lot. And my mom used to hate that. So if you see me doing this podcast, and maybe I'm getting a little stressed, but it's just something that people do. And that's what we've noticed. And chewing gum and other habits can lead to that too. But most of the people I've talked to, the biggest thing other than nighttime is while they're working during the day. Could be when they're driving, when they're, lifting weights, stuff like that. But a lot of people, their teeth are coming together, and that shouldn't be happening ideally.
So it's so interesting that you mentioned that about during the day that your teeth shouldn't be touching. So I have a couple of comments on that. One is, when I was thinking about us getting together and talking, I actually just on my own kind of did this sort of thing, and I couldn't believe how tense these muscles were in my face, because this is not a part of myself that I typically think of massaging. And I was like, oh my gosh, I'm really tight in here. And I don't have chronic headaches or anything, but I could not believe how tight these muscles were. So it was just sort of an aha moment for me to think, oh, I should probably be paying attention to this. And then also, what I think is interesting is I'm a yoga instructor, and when I'm getting people into a relaxation state as we're winding up our yoga, or I'm really focusing on deep breathing, I will guide people through dropping the tongue away from the roof of the mouth and relaxing the jaw.
Yeah.
And when I do that to myself, I do notice such a huge difference in just how air moves in and out when you intentionally drop your tongue from the roof of your mouth and relax your jaw.
Yeah.
So I'd kind of like to get your perspective on that, and then also sleep apnea.
Yeah, for sure. So my wife did a sleep study, and she had mild sleep apnea. She had some sinus issues too. So we were also asking about the neighboring areas, and going back to maybe, working on the computer, I forgot to mention about posture. So if your neck posture is not good, or you have neck tension, that can correlate to tension here, and then, with headaches too. But for sleep specifically, I think a lot of my patients, including myself, aren't getting the best sleep. I'm still guilty of looking at my phone before bed and things like that, and that can affect REM sleep. But in terms of sleep apnea itself, I think that, there's just a very clear correlation with that. And I've had patients who've gone onto CPAP machines, and then their clenching will get better at night.
Are they using the oral appliance?
No, so just a traditional CPAP, and so that'll help. But there are people who are just severe clenchers and grinders and happen to have sleep apnea, and they haven't found a solution yet, or haven't taken the initiative to do that. And I do mention about a sleep appliance, because that can kill two birds with one stone, because it'll help protect the teeth and open up the airway. So, and there are a lot of other new options too. I don't know if you've heard of Inspire. It's a device that they kind of implant down here, and there's like a remote that triggers it, and it's for sleep apnea also. Yeah, they said it's a human dog collar, so I don't know too much about it, but I did have a patient have that. So there are more and more options for sleep apnea, which make me feel better about hopefully helping bruxism also.
So when it comes to, I kind of want to circle back to how you think sleep apnea, a CPAP is helping to decrease clenching. Is it because of the force of the air that it's pushing the tongue down and it's making the jaw relax? Do you think that's what's happening?
When you're getting more oxygen and getting better sleep, I think everything is just more relaxed.
Okay.
So the body starts to sense in sleep apnea when your oxygen levels are decreasing, and the muscles will start to inadvertently move just to try to open up the airway and move the muscles a little bit. And even like my wife, Kristen, will tell me when she had more sinus issues, if she's trying to breathe, she has to like clench her teeth together just to forcefully get air, through her system. So I think it's that specific mechanism that leads to that correlation.
I guess it is really interesting to think about all the different, physiological, like the actual biology, how your body is made. And then breathing is so important. So you would think that it would be a really easy thing to do. Yeah. But it's amazing how many things can complicate that process.
Yeah. I've learned more about sleep and breathing, two things that I thought just happened naturally. I do meditation as well, learning about that. And then even mouth breathing versus nose breathing. And so there's just a lot into that. But and specifically with clenching and grinding, there is for sure that correlation, and it's just related to airway. Mm-hmm.
So you mentioned that your teeth are not supposed to really touch except for when you're eating. How is that taught? I feel like it's such in a resting state, you close your mouth and your teeth touch. So
and that's what we're used to, but the saying goes, lips together but teeth apart. Okay. And that's really how it should be. Okay. Because again, cracked teeth, root canals, crowns, extractions, those are happening more and more, and they're all on molar teeth, not on a lot of the front teeth, due to mechanical I have a picture on my phone. I won't show you that, but literally a patient, healthy tooth, no decay at all whatsoever. He was going through a lot of stress and anxiety. He was a former police officer. So during COVID, there was a lot of other stuff going on like that too. And he literally just cracked his tooth from so much anxiety and stress. So it's a hard concept to grasp, I think, for a lot of patients right now, because we're not recognizing it. And I think a lot of dental professionals aren't understanding it to the level that I've had to understand it because of my wife. So a lot of times we'll make a night guard, and dentists say this all the time. Night guards will protect your teeth, but it won't stop the grinding. So that's more of a Band-Aid technique, and it does help. But there are different types of night guards, or splints rather, that I've learned to make with the specialists that I've worked with that help decrease the load of the muscle and the joint from that clenching and grinding. So essentially what it is a night guard usually goes from your front teeth all the way to the back, and it's a thick appliance. And so people who clench and grind a lot and their muscles are so strong, their teeth will feel that night guard and still be able to clench on it. And that's why we don't recommend over-the-counter, boil and bite type night guards, because they're ill-fitting, so they'll move around and your jaw wants to mess with it more, and they're thin and squishy, and then you'll actually, even if you're having something in between your teeth, your muscles actually are doing more.
Yeah, because it's almost like your mouth wants to hold on to it.
Exactly.
It gives it something to grab onto.
Exactly. Yeah. And so, you've seen athletes chew on their mouthpiece a lot, right? So it's exactly that. And so what a splint typically does a little differently is the contact is more in the anterior, and now your back teeth are floating, and so your teeth are not touching at all, and your muscle doesn't think to turn on. And that's why it's so, again, lips together, teeth apart. And I will just get some cotton rolls, and I will put 2 in the back, and I'll feel their muscle and ask how they feel, and they'll notice. And then if I switch to 1 cotton roll and just lay it right in the front, and now their back teeth are floating essentially, they'll say, oh, that feels so much better. And I say, describe more, and they're like, I don't know, it just feels more relaxed. And then, so I won't kind of give them a heads up on it, but they'll describe it, and I'll say, let's do it again. But now I'll let them feel, and they can feel the difference. So it's just a difference, of flexing the muscle and relaxing the muscle. So we all want stronger muscles, but when it comes to this, we don't.
We don't.
We don't. Yeah, we don't.
And so can you talk a little bit, you mentioned about the front desk people are in splints. So what's the difference between a nighttime appliance and a daytime appliance?
Yeah, so this is in the category of splints. Going back, just the traditional night guard that most dentists will make are to just protect your teeth from, sharpening on each other or wearing each other down, so to speak. But splints are to protect the teeth, but also designed to start to relax and deprogram the muscle long term. So for severe clinchers and grinders, and we have this discussion with patients because first they have to recognize, I know it's happening, but they have to recognize that, and they give me feedback if it's happening during the day, if it's happening at night, or both. And so nighttime is typically harder to tell unless if it's really bad, a spouse will complain about it. Because they'll hear the sound of the clenching and grinding.
Oh my gosh, that sounds
terrible. It is like nails on a chalkboard, right? Or I have patients who will wake themselves up from that. Or in the morning, a telltale sign is their jaw feels sore, or if they have headaches specifically in the morning. Or some patients who have it really bad have locked jaw during the day because at night when their muscles are supposed to be resting, they aren't, and then they'll eat breakfast and do something, and then their jaw will literally, the muscle will spaz and lock essentially. But going back to your question, the daytime is to help put the jaw and the muscle in a position where there's less load on the teeth and the joint, and to just have it slightly more open so the muscles aren't constricting as much. And then the nighttime appliances for sleep specifically, so there's less, again, clenching and grinding.
I don't know if this is something that you can assess, but is there a correlation, do you believe, with tight masseter muscles and then sort of tightness also in the neck? And like what would come first, this or this, or are they always simultaneously, or can they be totally separate?
Yeah, chicken and the egg kind of question, I feel like, but oftentimes I do see both. In terms of what's coming first, I'm not an expert enough on that, but I will ask the question because I've had patients who've had really bad headaches, and I will suspect clenching and grinding, but we'll have them log and see, well, they don't think it's nighttime. And during the day, there's a little bit of it, so they start to relax. And, we'll talk a little bit later about other strategies on how to lessen that. But then they came back with the report, and I also didn't see a ton of signs on there. So then my next best guess is the neck, and I'll ask them to go see a chiropractor. And one of my patients, her headaches did go away after going to see the chiropractor, because I guess her neck and the posture was it wasn't in the right position. And, when things aren't aligned, your muscles tend to have to compensate. And I think that's what was going on. She actually did see a TMJ specialist, and he did a scan of her TMJ and said they're healthy enough. And she didn't have clicking and popping. So that's another thing before I forget. A lot of times it's asymptomatic, but if you hear clicking and popping of your joints, it's a sign that something is off or your muscles are pulling too hard on the joints. And on that note too, women are affected more than men with TMD. I thought it was because, my wife is in charge of a lot of things at home and at the office. So I think women just take care of a lot more things than some men do. So it could be that, I thought, just more on their mind. But they're saying now studies are showing estrogen levels can correlate more to TMD issues. So high or lower estrogen levels can affect if your joints are hurting or not.
And there are, with the clicking and popping and the challenges with the jaw, there are other things that I guess you're saying temporomandibular dysfunction or disorder as opposed to just the TMJ, which is what I had looked up and was also in the research, but that's just talking about the temporomandibular joint in general. But I have a piece of bone that never fused in my joint. And when I was younger, I would get locked jaw, and I would be able to tell when that piece it's just floating in there. I don't know where it's at now, and I don't know if you could see it on my x-rays, but this was back when I was 16, 17 years old, and I had to it was found when I had really specific imaging done for my wisdom teeth. I had to go in and get my wisdom teeth extracted when I was like 16 because they were starting to come up already, and that's where they noticed this. And there was a period of time in my 20s I got really bad headaches because it would push up against my facial nerve, and I would get numbness and tingling, and I definitely would have a restricted jaw movement. So I do think it's important to mention that there are, when you're talking TMD, it's like disorder. So there are multiple things that can affect your joint, not just the muscle. Yeah, for sure. So that is a good point to make. And, with patients, a lot of dentists, we will still call it TMJ, but we all have TMJ because we all have the joints. Right. But it's technically TMD. But for the general public, and that's why when you Google TMJ, it'll come up as that. But you hit on a good point of, in terms of genetics, some people just, this is something that, you had and most individuals don't. So you're more predisposed potentially to have joint issues. I have a crossbite, which is just a skeletal issue, and an underbite. So my teeth, the bite are a little bit off, and just naturally the way my jaw developed and shifted, I had a lot of clicking and popping during my high school years, and it took some orthodontic work and some appliances to help that go away. And it never bothered me, but that's how I know my clenching and grinding issues are improving, and I'm at less risk of having TMD because the popping and clicking has now subsided. But orthodontics, I actually had a really complex patient. Ever since she had braces when she was 17, she started developing terrible TMD and terrible migraines, and she's been living with this for over 10 years. And we finally were able to figure it out with our splints. But essentially, it took so much history. She tried so many doctors, tried medication. And a lot of, I think,
the neurologist and specialist she saw, I think their treatment would have worked but the root cause, we didn't hit the thing that started it all. And the key was getting the history. And she told me ever since I got braces is when it started. And that turned the light bulb on for me. But essentially, the orthodontist wanted to push her teeth back to make it look a little bit better because they were hitting kind of edge to edge. But the way her joint was and the way her jaw and skull aligned just didn't want that. And so when they set it back, it was actually pinching on that trigeminal nerve and then causing her headaches. So as soon as we put her in a splint and made her slide forward more, it went away. And, something, as simple as that, was causing just really, really, really affecting her life. And, this is why I feel like Kristen going through all that was a blessing in disguise, because I've been able to help a lot more patients now, because our specialist is wonderful and he can do this for all the patients much better than I can. But he's thousands and thousands of dollars more. And a lot of my patients, unfortunately, just the thought of paying for something like that stresses them out even more, which is counterproductive. So these splints that we make are very expensive. We make a little bit of profit just from chair time and the materials we have to use, but the lab fee is very expensive. And currently we're doing this as it's one of the lowest profit procedures in my practice, but one of the most rewarding for sure, because I saw what it was doing to Kristen, and it just caused her a lot of stress. I mean, we both have dealt with chronic pain, and for people who have, I mean, the pain is one thing, but mentally it's very, very draining.
Yeah.
Yeah.
Some of the most common symptoms, so you see mechanical things, so you'll see like teeth grinding, or you'll get a really good history. For me, when it comes to maybe reasons I should start thinking of sending people to you more, it's obviously headaches, right? So a lot of people will complain of headaches. I don't know how many people come in and actually complain about facial pain to me that I've asked, but definitely headaches and tension. And so what are some of the strategies that you recommend? You make oral appliances, so you do a complete history, you do your own assessment exam, and then what are strategies that you recommend for people to start dealing with this at home?
So I'll go over the strategies I give my patients specifically, but you touched on a good point in terms of, you may refer patients to me, and actually vice versa. But I think interdisciplinary care is key, because I can see it from my perspective, but I know wearing a splint or just a dental side is not going to always be the solution every time. Like I said, it could be a chiropractor. Functional med, I think, we won't go off topic, but in terms of gut health and things like that, how that can affect stress and anxiety, there's a lot of that a lot of people don't even realize. But specifically at our practice, it's kind of a approach where first, I think psychologically talking about the stress and making them aware of their clenching, I think number one is key. From a mechanical standpoint, obviously wearing an appliance will help that also. And then from a systemic standpoint, magnesium is a very good muscle relaxer. I'm sure you could probably talk more about that. And I started taking it first for stress, anxiety, and sleep. But it is a natural muscle relaxer. And dentists, unfortunately, the way we're trained, if you have lockjaw, all we can do is prescribe like Flexeril, just a muscle relaxer. And realistically, that's not something I would put my patients on long term. I wouldn't take that, right? So I think magnesium, and there's so many different types. I like glycinate specifically, but I've had a lot of my patients go on that, and it's helped them a lot too. So that's my kind of three-pronged approach, so to speak. And then also just looking at what other specialists or healthcare providers they can look at. And then something I will mention, but I don't really have too much advice on, is, stress relieving activities. But, meditation I do, My wife does yoga. I tried. It is so hard. I don't have the core strength for that, but I think those two things are very good stress relieving activities, and just any form of exercise. I recently, end of last year, got into pickleball. So I play a lot. I've been trying to cover this tan. So I have an Achilles injury.
Oh, no.
So I wear a brace, and my wife hates this tan line that I have. It looks like I wear really high socks, so I've been trying to cover it. But pickleball's really helped me get better sleep, relieve stress, and I think that's also helped me with my clinching and grinding.
Mm-hmm. Yeah, and I think from my perspective, I would, number one, wholeheartedly agree on an interdisciplinary approach. And you and I both appreciate chiropractic, and I know some chiropractors can do jaw release. I don't know if that's a technique everybody uses. I'm not a chiropractor, so I don't know common practices among all chiropractors, but you and I both know chiropractor very well, and I know she does a jaw release.
Yeah.
And I think, work on the axis and all of this 100%, if you have a skeletal or a mechanical dysfunction in one joint, it only makes sense that's stress related. It only makes sense that there's going to be a downstream effect, and that you're going to have more than one joint affected by your physical response to stress. So yes, I'm not a chiropractor. I don't do that type of body work. So I do recommend interdisciplinary treatment and integrative treatment plans.
Yeah.
But the things I do fall under my purview would be, of course, yes, I know everything kind of comes back to the gut, and you mentioned the gut, but there's just so much information about the microbiome and its effects on your emotional state. So, about 94 to 95% of serotonin that's made in the body is made and utilized in the gut. Only about 6-ish% of serotonin that's made in the body is produced directly in the brain, and it's used locally, so gut serotonin doesn't go to the brain, So, there's this whole term, your enteric nervous system or your gut brain. Well, that's because we have a lot of neurotransmitters that function in the gut, and some of that neurotransmitter production is dependent on your microbiome balance. Wow. And so understanding the effects of your microbiome on your psychological stress response, and then also your psychological stress response, how that affects the microbiome. So it's definitely a bidirectional relationship, and there's a whole field of study coming out now called psychobiotics, right? So instead of probiotics, psychobiotics, understanding the direct correlation between certain bacterial strains and your emotional health and your response, everything from schizophrenia to bipolar to depression. So very significant correlation there. And you can kind of use the idea of this stress here. It's very hard for me to imagine there being an individual who is stressed enough that they're clenching their jaw and not also clenching their gut.
Wow.
Like when you're stressed and you're holding on to that tension. You're not gonna do it in one place.
You're right. You're right.
So if you're stressed, you're probably stressed everywhere.
Yeah,
right? So I know I carry a lot of my stress here. I have, if you go to massage me, you're going to think you're on bone up here. I carry so much stress up here. But all the way down, right? So learning how to soften and relax the body and keying into the physiological manifestations of how you're carrying your stress. You kind of talked about it. For you, the first step is getting people to recognize that they're actually clenching their jaw, and you see biological changes. They're literally changing their body by clenching their jaw.
Yes.
And so I agree that one of the first steps in helping people is for people to understand the mind-body connection.
Yes, 100%.
And that you can take control of how you're responding to your stress by recognizing where are you holding it.
Yes.
There's such a clear correlation between our lifestyle, our choices, and our health. And it's oftentimes very hard for people to buy into the fact that certain lifestyle patterns that they have adapted that are comfortable because they're routine, that those may actually be impacting their health in a negative way.
For sure.
Right.
Yes.
And so when I talk to people about intentional rest and restoration and restorative practices, it's helping people make that mind-body connection and understanding that intentionally relaxing, it has a profound effect on the downstream your overall health. Right?
Yeah.
And so you're giving people appliances to loosen and relax this connection between their muscles and their mental health, right? You're changing their biology. People could just also set a reminder on their phone. Everybody wears some kind of a smartwatch or has their phone with them. You could set a reminder every hour to let go, like lips together, teeth apart. Like, you don't need a device to do that.
Yeah.
I see where the device would be very helpful, and I would never tell somebody not to get a device because it's hard to retrain the body, but it is something you can do. You can relax on your own.
Kristen actually did that for a while to pay attention to that, and also to get up off her desk for just to stretch a little bit. So no, definitely. And you know, the appliance, I think, is honestly a last resort. I mean, nobody wants to wear something, especially during the day, but at night, and some patients just can't get comfortable. And that's why we'll do the test and we'll give other options. And I ask them very frankly, do you think you can fall asleep with something like this? I'll show them the appliance. My girls from the front will come in and show them the daytime and what it looks like. But the last thing I want patients to do is invest in something that they can't even use.
Yeah.
And so I think there are definitely a lot of other options out there. And for TMD specifically, my goal now is to educate and make patients aware of this before it gets to that point. Because when they have pain here, or their jaw is locking, or they have headaches, it's now much more difficult for me to treat. So now I'm having this conversation a lot more often, and my prescription, so to speak, is magnesium, recognizing and trying to relax and doing these things before we have to get to a splint or something like that.
Yeah, prevention.
Yes, exactly.
Now, there are some stretches which I do also really like, and so really doing gentle, I do think that if you're locking up here, you're also probably locking up down here too, and I feel like really gentle head rolls, I like to just tell people to drop their ear to their shoulder, sit up nice and straight, shoulder blades together and down, and then just drop your ear to your shoulder. Now, you never want to really roll your head back. That's actually not good for your cervical spine, but you want to kind of go ear to shoulder and then really go slowly forward, ear to shoulder. I'm doing it very slow. But then also, I was doing it fast. You would want to do it slow. Also, what you can do to deepen that stretch is ear to shoulder, and then you push the opposing shoulder down and you reach your fingers down. And then you can kind of turn your head just a little bit, but you'll sort of get this aha stretch where you just feel it lengthen from here all the way down. And that is just a beautiful thing. And then you would do it on the other side. And then maybe while you're doing that, focusing on dropping the tongue away from the roof of the mouth and relaxing the jaw.
Yeah.
And that would be a really simple thing for people to do, maybe for 10 rotations back and forth, and to do that periodically during the day to really just sort of stretch that out and give this time just connecting that, what it feels like to relax this.
Yeah.
But also what I did, I really think massage is great, self-massage. And, even after I demonstrated this initially and I started doing it, I had a sensation of just like the tension. I realized how much tension I have in here. Yeah. Probably everybody does, because you talk and you're always moving your jaw. And so I feel like just connecting with that and people just sort of doing this throughout the day, it feels actually amazing.
And it gives you like a mental break too. I think when I started meditation, I didn't realize like at what speed and constantly my mind was always running. So I think, stretches, and that's why exercise and you get in this state of flow. I think, that's just good to have these mental breaks throughout the day. So our mind can take a break. So, no, that's really good. And thank you for sharing about the gut clenching, so to speak. And I majored in psychology in undergrad, and serotonin was a big topic, and I never even knew about, the gut and serotonin. So that's very helpful. One last thing I did want to touch base on that I didn't get to cover is Botox.
Oh, yes.
Yes.
Of course.
So that's a very popular option for a lot of people nowadays. I think the topic gets brought up because of aesthetic reasons at first. But Botox can help with TMD and muscle relaxation, or so to speak. It turns it off for about 3 months. My research and talking to a TMJ specialist, I do want to let people who are listening that it is a last resort, or should be a last resort. But for patients who've tried everything, that is an option. And my brother is a dermatologist in Philadelphia, so I've asked him about a lot of that. He does more Botox, but not fillers, because he said fillers stay in the body a lot longer.
Yeah.
But Botox will, deaden the nerve, so to speak, for about 3 months. The concern with that too is you just have to keep getting Botox, but also they're now saying that sometimes when the nerves reconnect, it may reconnect stronger, or long term, I guess we just haven't done enough studies, is what if the muscles just kind of die off, so to speak, or just don't regain the function that we need. So just throwing it out there in case people have heard about that. And there are a lot of dentists more and more doing Botox. I think it's very popular with continuing education courses. I think it's being sold as a practice builder. I don't do it personally, but I would say if you have a dentist who's well trained, my brother and I, we argue about this all the time, but I think dentists do better injections than probably dermatologists would do, even just because we use needles more than they do. We're down to the millimeter, so to speak. So I think dentists who do Botox, I would trust them as an option, but just know it's more of a last resort for TMD.
Well, I was just going to ask, would that be a great, 3 months to just get started for some relief while you're working on the oral appliance? But then now the idea that the nerves could regrow stronger, maybe not such a good idea.
Yeah, it just depends, and it is an option, but we typically, in healthcare in general, but in dentistry, we try to start with the most conservative option, because we can always build off that. For example, if I have a cavity that's very close to the nerve, but they're asymptomatic, I don't see infection yet, I will explain to the patient, we always try first without the root canal, because if the nerve doesn't recover, we can always still do the root canal, but if we jump straight to that, we'll never know if the nerve could have healed on its own.
Yeah.
And nobody wants to do a root canal, so they're usually on board with that option. Yeah.
Well, this has been a fascinating conversation, and I want to bring you back and talk more about other interesting topics that we could both share some information on.
Yeah,
so,
thank you for having me. Appreciate it.
Thank you, everybody, for listening to our podcast today, Elevate the Conversation. Again, this is Dr. Jonathon Chang with Sweet City Smiles in Sugar Hill, Georgia, and we appreciate your time and hope you have a great day. Bye.
Thanks.